Do you know what is the difference between steroids and corticosteroids?
Do you know why steroids are always linked with the drug abuse?
Do you know why corticosteroids are clinically more important than any other class?
Do you know why steroids have more disadvantages than their advantages?
Hello everyone, this is Danish Riaz.
And this is the Heptide from ZNets.
Today we are gonna talk about corticosteroids.
And steroids.
Could be us. So back to what I was saying. Could be us.
Now we will see the difference between steroids and corticosteroids. So, steroids are the man-made version of steroidal hormones like progesterone and testosterone, while corticosteroids, which are the man-made drugs that resemble to cortisol, which is a hormone released from the adrenal gland. The use of steroidal drugs causes additional and unnatural muscle growth, and also it causes the growth of hair, mostly on the faces, while corticosteroids are mostly used to reduce chronic inflammation. The steroids help to enhance your performance in sports like your speed and strength, while corticosteroids cannot increase your performance when it comes to athletics unless athletes suffers from asthma. Steroids can cause sexually performance effects and can lead to birth defects, while corticosteroids do not show this effect. Steroids are purchased in the same way as an illegal substance is purchased, while corticosteroids do not require any great deal of secrecy and are available openly. So this was the whole difference between steroids and corticosteroids. Why corticosteroidal drugs are more important than any other class? Prednisone, methylprednisolone and hydrocortisone. These are the three main important corticosteroidal drugs. They do not make you faster and stronger, but their main goal is to decrease chronic inflammation. The natural source of corticosteroidal hormone, which is called cortisol, is adrenal glands. Cortisol is very similar to hydrocortisone, which is a corticosteroidal drug. Now, how corticosteroidal drugs decrease inflammation? There are basically two main ways or two main functions. That's how corticosteroidal drugs decrease inflammation. The first one is that corticosteroidal drugs binds to the glucocorticoid receptor, which is mainly present on each and every cell of our body. Then cell sends signal to decrease or inhibits the synthesis of pro-inflammatory proteins. And when pro-inflammatory proteins will decrease, then inflammation will automatically decrease. While the other way is that corticosteroidal drugs stimulates and inhibits certain genes in the cells. By inhibiting and stimulating that genes, it increases the formation of anti-inflammatory proteins, and these anti-inflammatory proteins has many important function to decrease inflammation. So these are two main ways by which corticosteroidal drugs decrease inflammation. Now there are mainly 5 dosage forms of corticosteroidal drugs, which are topical, oral, inhaled, injection and intravenous. Now first of all we will study oral. So prednisone, methylprednisolone and hydrocortisone, these are the three main oral corticosteroids. Prednisone and methylprednisolone can be taken once or twice daily, and they should be taken in the morning, because when we take these drugs in the evening they can cause insomnia. The other drug is hydrocortisone, which is very similar to our natural hormone which is released from the adrenal gland called cortisol. That's why we can take hydrocortisone twice or thrice in a day. The second most important dosage form of corticosteroid is IV corticosteroids. So methylprednisolone, hydrocortisone and dexamethasone, these are three main IV steroids. We prescribe IV steroids when the patient can't take oral corticosteroids or when the high concentration is needed. Now the next important dosage form of corticosteroidal drugs is topical corticosteroidal drugs. Topical corticosteroidal drugs include fluticasone, clobetasol, and hydrocortisone. These are three main important corticosteroidal drugs which are used topically. Inhaled corticosteroids are the fourth dosage form of corticosteroidal drugs. Most important inhaled corticosteroids include fluticasone, budesonide, and beclomethasone. And these inhaled corticosteroids are usually prescribed for asthma and chronic obstructive pulmonary disease (COPD). Betamethasone and methylprednisolone. These are the two most important formulations of injectable corticosteroids. Injectable corticosteroids are usually prescribed for arthritis and joint and tendon inflammation, and these injections are directly delivered into the joint or tendon that is inflamed. There are basically three most important conditions for which we use corticosteroidal drugs, which are lung conditions, allergic conditions, and autoimmune disease or rheumatic disease. The most important lung condition for which we use corticosteroidal drug is asthma and chronic obstructive pulmonary disease. The second condition for which we use corticosteroidal drugs is allergic reactions. Here are some important signs of allergy, which are rash, redness, hives, coughing, sneezing, and swelling. There are basically three most important treatments we use for allergic reactions, which include corticosteroidal drugs, antihistamines, and epinephrine. Along with these list, corticosteroidal drugs are the most important for allergic reactions. Autoimmune diseases and rheumatic diseases are the third conditions for which we mostly use corticosteroidal drugs. In autoimmune disease, the immune system becomes confused and it starts to attack our own body's part. Immune system can attack any part of our body like gastrointestinal tract, urinary tract, eye, mouth, each and everywhere. It can attack anywhere. So corticosteroidal drugs are the first line of treatment for autoimmune diseases. Now we will see the side effects of corticosteroids. First of all, it causes increase in blood sugar level. So the patients of diabetes or pre-diabetic patients should take these drugs, corticosteroidal drugs, with cautions. Second side effect of corticosteroidal drug is irritability, moodiness, and insomnia. So if you are taking a corticosteroidal drug, then you should be prepared to change in your mood, and these corticosteroidal drugs should be taken in the morning. So if you are taking these drugs in the evening, then these drugs can cause insomnia. Osteoporosis and avascular necrosis are the third side effect of corticosteroidal drugs. So corticosteroidal drugs may impact on the health of a bone, because corticosteroidal drugs may decrease bone mineral density, and this is the risk factor of bone fracture and can lead to osteoporosis. And corticosteroidal drugs may also cause avascular necrosis or osteonecrosis, which is a rare complication in which there is an interruption of blood supply to the bone. Corticosteroidal drugs can also affect your ocular health, means it can also affect your eyes. So if you are taking corticosteroidal drugs for long term, then you must contact with your eye specialist, because corticosteroidal drugs can cause cataracts and glaucoma. Corticosteroidal drugs can increase susceptibility to infection, because corticosteroidal drugs decrease inflammation by decreasing immune response to inflammation. So when immune responses and immune reactions will decrease, the susceptibility to infections may increase. So these were the side effects and whole discussion about corticosteroids.
Anadrol, oxyndrin, and winstrol. These are the anabolic steroids which resembles structurally and functionally to the testosterone and to the progesterone. So let us discuss the clinical uses of the anabolic steroids or simply steroids. And we will see that in which conditions doctors are going to prescribe these anadrol, winstrol and other anabolic steroids. So when a male goes to the doctor and tells him that his conditions involve very much loss of weight because of some infections. The patient might be of HIV in the remote past. So if the patient was suffering from HIV in the remote past and he has lost his weight very much, then anadrol, winstrol or any other anabolic steroid will be prescribed by the doctor. There is another condition: a woman goes to the doctor and tells her condition to the doctor, and doctor diagnoses her with breast cancer. So in breast cancer, anabolic steroids can be used as well. But there is another condition in which a teenager goes to the doctor and tells his conditions that there is no beard, even at the age of 18, 19 and 20, there is no beard, there is no penis size increase. So what will the doctor do? Doctor will prescribe him with some of the anabolic steroids in order to make him mature sexually. Okay, anabolic steroid will cause the growth of facial hair that we call beard and will cause the maturity sexually. And there is another condition in which it can be used: diabetes. It decreases glucose concentration inside the blood, so it can be used for the diabetes as well. Moreover, if a patient goes, female or male, boy, girl or any other old man or old woman goes to the doctor and tells the doctor his or her conditions. What are his or her conditions? There will be swelling of the body, there will be swelling of the tongue, there will be swelling of the throat, and there will be swelling of the face. So doctor will prescribe him or her with anabolic steroids, because anabolic steroids are going to decrease the swelling, and this swelling of face, of tongue, of throat is known as angioedema. In the introductory clip, I have mentioned that anabolic steroids have more disadvantages than advantages, and anabolic steroids are always linked with abuse and with the illegal transport, means smuggling. So why? Let me give you the answer now. The answer is very simple. That is more and more side effects that are caused by the steroids. Then the question arises, why anabolic steroids have more side effects than any other class of the drugs? And the answer is very simple, but I will give you the answer in the mode of action segment. So now we have to see that what are the different disadvantages of this drug. Means we will see contraindications and side effects. So what if you're suffering from heart diseases, or if you're suffering from hypertension, if you're suffering from diabetes, or if you're suffering from high cholesterol level in your blood, then you are more prompt and you are more susceptible to death if you're using anabolic steroids. So you have not to use steroids in these conditions. Moreover, in pregnancy and in breastfeeding, you are not allowed, you are not recommended to take anabolic steroids. There is another condition in which you have not to use anabolic steroids, and when you are teenager or when you are younger, at the age of 14 and less than 14, you can't use testosterone derivatives. Why? Because it will cause stunt growth of your bones, due to which your height is not going to increase anyway. Your bones are not going to grow anyway. That is why it is not recommended, it is contraindicated when it comes to the children having age less than 14 years. So what about dose? Dose will be adjusted according to the conditions of the patients. Mostly 25 milligrams or 20 milligrams are prescribed by the physician to the patients. Now let's talk about the side effects which are produced by the anabolic steroids. So number one is the nausea and vomiting that is general and always linked with many of the drugs. Then it causes headache as well. It can cause liver disorders, it can cause kidney disorders, kidney dysfunction, kidney impairments. It can cause liver diseases, liver dysfunction, and it also causes some depression. It also causes aggression. It will cause swelling of your feet. It will cause swelling of your lower legs. It will cause heart diseases. It will cause increase in the cholesterol level, due to which heart diseases will obviously appear. Then it will also cause bone pain, muscle cramps, and it is also linked with sexual activities as well. What kind of sexual activity? It will increase or decrease the sexual desire inside the patient, but it will cause the inability for the sexual arousal. It will also cause appearance of the female characteristics in the males and appearance of the male characteristics in females. How? If females take anabolic steroids, then there will be appearance of facial hair on their faces, and if males use anabolic steroids, then breast tissues will swell up and the breast size will increase. As prostate gland cancer, unusual bleeding, and unusual weight gain as well. So that is the list of the disadvantages or the side effects or the.
So let us discuss mode of action now. Here you can see over me passing and going here cell membrane, and over the cell membrane you can see a red dot that represents the steroids. Now that red dot steroids, anabolic steroids, will cross the cell membrane, will come inside, and when it will come inside, there is a receptor present. Here is a receptor. You can see there will be binding of the steroids with this receptor, and this receptor will go into the nucleus. From the nucleus it will bind to the DNA, and with the DNA it will cause the production of messenger RNA. And the messenger RNA is produced, it will leave the nucleus through the pores and it will go into the cytoplasm again. And then ribosomes will come into action, and ribosomes will bind to the messenger RNA and will cause the production of proteins. These proteins will be actin, myosin, means those proteins which will be able to function in order to increase the weight. Now steroids are highly lipophilic in nature. That is why whatever is a kind of the membrane that will be crossed by the steroids. The most tightened junctions are present inside the blood-brain barrier, but these steroids can produce effects on the brain as well, and it can penetrate into the brain as well because of being more lipophilic in nature. That is why the side effects of steroids are very much, because these steroids are going to penetrate in each and every kind of the cell present in our body.
We're beautiful.